a very warm welcome to this important event in the observance of the Zero Discrimination Day. This event is co-hosted by the UNAIDS Thailand, the Ministry of Public Health, and the Ministry of Foreign Affairs of Thailand. Before we begin, please allow me to give you the sequence of today's program. For the opening session, we are honored to have His Excellency Mr. Vishawat Isarapakdi, Vice Minister for Foreign Affairs, to deliver a welcoming remarks, followed by His Excellency Mr. Anutin Chanvirakul, Deputy Prime Minister and Minister of Public Health, to give an opening remarks. Afterward, there will be a keynote statement by Mr. Emmon Murphy, Deputy Executive Director of UNAIDS Program Branch at Interim, who will give a keynote statement and followed by a group photo session. The next program will be a panel discussion moderated by Dr. Taksapon Thamarangsi, Director of International Health Policy Program, who will also moderate a Q&A session. And the event will end with a brief summary by Dr. Pisha Prempi, Deputy Director General of the Department of Disease Control, followed by a closing remarks by Director General Exili Pintaruchi of the Department of International Organizations. Without further ado, may I invite His Excellency Mr. Vishawat Isarapakdi, Vice Minister for Foreign Affairs, to deliver his welcoming remarks.
Your Excellency Mr. Anutin Chanvirakul, Deputy Prime Minister and Minister of Public Health, Mr. Taufik Bakali, UNAIDS Regional Director for Asia and the Pacific at Interim, Excellencies, distinguished panelists, ladies and gentlemen. At the outset, I am pleased to extend a very warm welcome to all of you to this high-level seminar, co-hosted by the Ministry of Foreign Affairs, the Ministry of Public Health, and UNAIDS. It is a particular pleasure to receive Deputy Prime Minister Anutin at our ministry once again. Today's seminar is held to observe the Zero Discrimination Day, which falls on the 1st of March every year. On this day, we celebrate the right of everyone to live a meaningful life with compassion and dignity. This seminar also aims to provide a platform for an in-depth discussion on the current stage of stigmatization and discrimination against people living with HIV/AIDS around the world. And more importantly, how best we can work together to address these issues and promote more inclusion in our societies. For Thailand, Her Royal Highness Princess Somsawali Gromamun Sutatnarinath, the UNAIDS Goodwill Ambassador for HIV Prevention for Asia and the Pacific, has worked tirelessly in supporting the country's response to HIV for almost 30 years, notably in promoting the prevention of mother-to-child transmission of HIV and the introduction of the pre-exposure prophylaxis or PrEP in Thailand. Today, HIV is still one of the world's most serious public health challenges. In particular, amidst the COVID-19 pandemic, the number of people belonging to key populations who have limited access or avoid receiving appropriate treatment due to stigma and discrimination remain disconcertingly high. And if we are to achieve the SDGs for ending AIDS by 2030, the international community needs to redouble its efforts in the following areas. First, by promoting universal health coverage that places emphasis on access and affordability of essential health services. No one should be pushed into poverty owing to the expenses of essential health services. That is also in line with the UN Secretary General's report on our common agenda. Second, by strengthening national, regional, and global cooperation, including through sharing and supporting technology transfer, know-how, and sustainable funding to further enhance AIDS response capacity at all levels. Third, by transforming into reality the political commitments made under the Global AIDS Strategy 2021 to 2026 and the 2021 UNGA Political Declaration on HIV/AIDS. It is a time for action. We must end the pandemics of stigma and discrimination as we work to end AIDS more effectively. And fourth, by forging wider participation and engagement of people living with HIV, as well as local communities, in designing, shaping, and implementing approaches for HIV/AIDS prevention and service delivery, which in turn will also help address HIV-related stigma. Excellencies, ladies and gentlemen, Thailand is honored to assume the chairmanship of the UNAIDS Program Coordinating Board this year under the leadership of Deputy Prime Minister Anutin. Our team stands ready to work closely with all member states and stakeholders to chart a way forward for an even more robust global AIDS response. I would end here by thanking all panelists and participants who have joined us in solidarity in the fight against stigma and discrimination as we work towards achieving our common goal of ending AIDS as a public health threat by the year 2030. I thank you.
Thank you, Excellency. May I now invite His Excellency Mr. Anutin Chanvirakul, Deputy Prime Minister and Minister of Public Health, to give an opening remarks. Please.
สวัสดีครับ Good afternoon to all. And Excellency Mr. Vishawat Isarapakdi, the Vice Minister for Foreign Affairs of Thailand. Excellencies, distinguished guests, the Regional Director for Asia and the Pacific, Mr. Taufik Bakali. Ladies and gentlemen, we are at the last section of the milestone toward AIDS by 2030. We have to end it by that year. With only less than 8 years to achieve this target, we need to reaffirm our commitment and intensify the implementation of the 2021 Political Declaration on HIV and AIDS and the current Global AIDS Strategy. Ending inequalities is the key to ending AIDS. Eliminating HIV-related stigma and discrimination is one of the key areas to ending inequalities. The high-level seminar today is organized in observance of the Zero Discrimination Day on the 1st of March and to raise awareness and enhance global commitment on eliminating HIV-related stigma and discrimination. HIV-related stigma is everywhere, at homes, workplaces, schools, health facilities, and even in the legal sectors. Consequently, many people are reluctant to seek and get services, including HIV testing, treatment, and support. Certainly, this reluctance delays the progress toward ending AIDS. Likewise, reducing discrimination is not easy as it involves changing ideas, beliefs, and values that have been deeply rooted in society for a long time, as well as changing practices, guidance, and laws that harms or hinders people accessing to HIV services. Thailand is a pioneer country to join the Global Partnership for Action to eliminate all forms of HIV-related stigma and discrimination. Government, civil society, and community of people living with HIV/AIDS and the key affected population had jointly developed Thailand Partnership Action Plan to end HIV-related stigma. To implement the plan, we will raise funding support and work with all sectors to tailor the best interventions for each setting. As the chair of the UNAIDS program coordinating board for this year, Thailand and these PCB members have placed elimination of HIV-related stigma and discrimination a priority to reduce inequalities and ending AIDS by year 2030. To achieve this ambitious goal, greater commitment, cross-sectoral coordination, and concrete actions are required to make a transformative change to ending stigma and discrimination. I believe the exchange and discussion among all of us here, as well as distinguished panelists and participants today, will enhance the global effort in achieving our goal. I thank all panelists and everyone for your effort toward ending AIDS. And I wish this seminar a very successful outcome. Thank you.
Thank you very much, Excellency. I would now like to invite Mr. Emmon Murphy, Deputy Executive Director of the UNAIDS Program Branch at Interim, who is joining us online from Geneva, to give a keynote statement. Good morning, Mr. Emmon.
Sawadee Kap, good morning from Geneva. Your Excellencies, ladies and gentlemen, it's a great pleasure to be invited to join you this morning, this afternoon for you, at this important event that the Royal Thai government is hosting. Unfortunately, the Executive Director, Ms. Winnie Bianima, could not be with you in person and has asked me to deliver a statement on her behalf. Excellencies, last year the world adopted the new targets on HIV and AIDS through the UN General Assembly political declaration. For the first time, countries have committed to specific, achievable targets on stigma and discrimination for people living with HIV and those affected, women and girls, and key populations. These targets speak to the critical importance of human rights and societal enablers, and the intersection between rights, societal enablers, and health issues, as Thailand has so well demonstrated and other countries in the Asia-Pacific region are working towards. By achieving the societal enablers, we will avoid an additional 2.5 million new HIV infections and an additional 1.7 million AIDS-related deaths by the year 2030. So to put it another way, reducing stigma and discrimination saves lives. But, as we just heard from His Excellency, the Deputy Prime Minister, we must act now. We must act together, and we must act at scale sufficient to reduce inequalities and to ensure that we end AIDS for everyone by 2030. And because our health is influenced by every aspect of our lives, our actions must consider the multiple and intersecting forms of discrimination and inequalities that people face and the structures that create these. It's for this reason that the Zero Discrimination Day this year focuses on enabling legal environments. We must ingrain equality and non-discrimination deep into our legal systems and to ensure that the laws which shape our society protect and empower the most vulnerable. But not just the laws on the books, but how they are implemented in society at all levels are critical to these successes to be achieved. Excellencies, ladies and gentlemen, the global partnership to end all forms of HIV stigma and discrimination recognizes this by ensuring justice is one of the 6 settings prioritized for legal reforms. The global partnership is a crucial platform for scaling up evidence-based and concerted action on stigma and discrimination. On behalf of the Executive Director, I'd like to thank Thailand for being one of the very first countries to join this global partnership in the year 2018. and for its leadership since then, driving tangible impacts and inspiring the 30 other countries that have now also joined the global partnership. I urge all countries to join this partnership as we move forward together in reducing inequalities. 2022 is the first full year for implementing the new global AIDS strategy and is a critical moment for scaling up action on stigma and discrimination. We are very fortunate and honored that this year, Thailand is again chairing our program coordinating board, not for the first time. I look forward, as does the Executive Director, to working with His Excellency Deputy Prime Minister and Minister for Public Health, Anutin, working with him and taking advantage of his leadership to make zero discrimination a reality. His Excellency has offered to host our program coordinating board in Thailand in December of this year. And this will be a critical opportunity for Thailand to showcase to many other countries across the world the great progress it's made on stigma and discrimination among many other programs. And this will be a great first-hand opportunity rather than sitting in a boardroom listening to speeches to see in reality how this can happen at the local level in hospitals and other settings so that people living with HIV are able to access the full services they require like everyone else in society. Thank you very much again on behalf of the Executive Director for both hosting this important event with member states from the region, but also for the continued leadership by the Ministry of Public Health and its community and technical partners in the response to HIV in Thailand. Khop kun krap.
Thank you very much, Mr. Emmon Murphy. Now we arrive at the group photo session. May I invite the Deputy Prime Minister Anutin, the Vice Foreign Minister Vichawat, Dr. Ophat Kankawinpong, Director General of Department of Disease Control, Mrs. Ek Sili Pintaruchi, Director General of Department of International Organizations, and all the panelists proceed onto the stage for a group photo session, please. Please proceed onto the stage. Yes, we have the first shot, and the second shot, I would like to ask the all people to make your hand like a butterfly. This is a symbol of the Zero Discrimination Day. Okay, thank you very much. We end the group photo session. Next, we will have the panel discussion. Okay, we will now proceed to the panel discussion. May I invite the moderator and all the panelists to proceed onto the stage for the panel discussion. Okay, I would like to give the floor to Dr. Taksapon, who will moderate the discussion, followed by Q&A session. Dr. Taksapon, the floor is yours.
Thank you very much,ครับคุณ a very good afternoon to you all, and very good morning, good afternoon, and good evening for everyone join us virtually. It is on behalf of the Ministry of Public Health, it's our great honor to organize this technical seminar. Today with us we have 5 panelists, 4 panelists on site, and 1 panelist joining us through the virtual mean. Let me introduce all our panelists at once, so then we can join and start the discussion later on. We have Mr. Taufik Bakali, the UNAIDS Regional Director for Asia and the Pacific at Interim. Then we have His Excellency Mr. Keptines Lindsay Kimwole, Ambassador of the Republic of Kenya in Thailand. Thank you very much. Then we have Mr. Joel Harding, Deputy Ambassador of the British Embassy to Thailand. And then to join us online is Mr. Harry Prabowo from Asia Pacific Network of People Living with HIV/AIDS, or APN+. Harry, you join us online. And last but not least, we have our future here, Ms. Ika Noviyanti, Youth Lead from Asia Pacific Network of Young Key Population. Have all panelists are already on board. Extensive friends, colleagues. So since 2014, the first March is the day for the world to celebrate the right of everyone to live in a full and productive life and live it with dignity. Yes, it's Zero Discrimination Day. And for this Zero Discrimination Day for 2022, just celebrated last week, for the HIV area, was under the theme, remove laws that harm, create laws that empower. So we have heard again and again that stigma and discrimination, or you can short it as S&D, are critical and persistent barriers to the global response to HIV pandemic. Stigma and discrimination are those unfair treatment practice and policy and law based on negative or irrational attitude or judgment. It happens in many settings, from community to workplace, including settings where we have zero tolerance for this discrimination and stigma, such as in healthcare, where people, as guided by our Deputy Prime Minister, people get test, treatment, and service. Still, the practice of discrimination is still very much there. It is highly unacceptable there. And as a guide by His Excellency Vichawat, that it is now for us to show our global solidarity, how we can tackle S&D together. And we aim S&D, we aim inequality to promote the inclusive society for people living with HIV, or people with high risks for HIV. And it's time for action, as informed by Emon there. So S&D is a barrier to SDG, and it's the 10 target. We have the first time we have the target on societal enabler. Less than 10% of countries have punitive law. Less than 10% of people living with HIV experience stigma and discrimination, and less than 10% of women, girls, people living with HIV and key population experience gender inequality and violence. That's our ambitious goal. So joining with us, we have perspective from government, from civil society, from youth, and from international agency. So, but first of all, let's learn from Kenya. Kenya is the vice chair of the PCB, but also well known for the best practice in creating the law to support and address and tackling S&D. With that, let me turn to His Excellency Mr. Keptines Kimwole about what is the situation and what are the challenge And what can we learn from Kenya? The floor is yours.
Thank you. Thank you, sir, for this opportunity to share experiences from Kenya on what we have been able to do for the last 38 years when the first case of COVID-19 came to Kenya. I have a PowerPoint presentation, and I would like to request that we start from slide 8, but just flip through the first 8 slides because the focus is on discrimination. The rest are details on what we have done so far. But since my question is on S&D, go to the slide that starts with the situation in Kenya. Next, please. Okay, I'll focus my presentation on the key challenges and efforts to address HIV-related stigma and discrimination in Kenya. Next, please. In a nutshell, S&D remains a major challenge in the response to HIV in Kenya. When the first case was diagnosed in 1984, we have made great efforts to reduce the infections, to reduce stigma and discrimination, but it remains a challenge. For instance, in one research, 44% of men said that they will not host or even eat or buy anything from someone who has HIV, while 26% women said they will not associate with people who have been diagnosed with HIV. So it remains, S&D remains a very persistent issue. There are so many negative attitudes towards people with HIV. Some of the groups include discordant couples, or couples who are not faithful to one another. We also have cases in the prison communities, trucking communities or truck drivers going across the East African region. We also have fishing communities. We have had cases in Kenya where there's something called fish for sex. That I give you fish, you give me sex. And then we have young people. Today, the biggest problem that Kenya faces are infections between children of 15 years and adults, young adults of 49 years. And then, of course, we also have transgender people in Kenya. We have so many sex workers. And we have people who inject and use drugs quietly or illegally. Next, please. So the situation continues to abate because of, for example, police harassment. In Kenya, if you tell someone that I'm a sex worker, it is some kind of a taboo because it is a criminal offense in Kenya to be a sex worker. It's also a criminal offense to talk about men who have sex with men. So the police have taken advantage to harass some of these people. When they are arrested sometimes, they are detained, and the police have no knowledge that probably this sex worker has HIV. Of course, many have faced humiliation, physical violence, emotional violence, and sometimes public ridicule. If I just give a case example where I was personally affected, I had a niece who was diagnosed with COVID-19. She got it from the husband. So when the husband died, she started becoming sick. So we took her to hospital. She was checked and she was diagnosed with HIV. And she was in the hospital with her mom, a single mother, and the brother. But the moment the results came, the mother and the boy, or that's the brother, walked away, never to come back. So this girl started, crying and thinking of even suicide. So we took her in, we counseled her. She had given up on life. She was telling my wife that, please take care of my 6 children, I'm going to die. And we told her, no, you will not die. Even if your mom and your brother have abandoned you, we are there for you. As we speak today, that was in 2001. As we speak today, this young lady has educated all her 6 children. She lives in her own farm. And she's still alive. So she has lived a positive life because of the fact that we engaged her and encouraged her, and we told her that life does not end with HIV. You can live with HIV for as long as you are going to live. Next, please. Yeah, so we continue to face a situation where, because of stigma, people do not or fail to come up to speak and say, I have HIV, because of the fear of ridicule and shame. And if you look at those figures there, you'll see that 30.0% of sex workers have faced emotional violence, while those who have faced physical violence are about 25%. Others are even blackmailed. And of course, we make, if you see someone, in Kenya, for example, if you know that someone has HIV AIDS and it passes somewhere, people always make funny, comments about her or about him. You see that guy passing there, that guy has HIV AIDS, please take care, be careful. Those are some of the comments that we hear from people when someone is aware that he or she is diagnosed with HIV. Next. So we continue to face challenges. People who live with HIV/AIDS, and even those affected and caregivers, continue to face challenges. In one research, for instance, 1 out of 5 of sex workers reported having avoided seeking health care because of fear that someone will know that I have HIV or I'm diagnosed with HIV. And then 1 out of 5 again, or 20% of those who are transgender, fear to go to hospital because of being identified or being known that this is a transgender person. Again, because of social norms and cultures in Kenya, for instance, or in Africa in general, people who are transgender cannot speak out because it is a cultural taboo according to most of our African cultures. For example, men having sex with men. It's a taboo. People will even stone you. And I'm sure it's even worse in the Muslim community. I have lived in some Muslim communities, or rather in some Muslim countries. Even talking about HIV is a taboo. People hide. I had a case in one country where I worked, where a Kenyan lady was in prison and she had HIV/AIDS. But that country does not buy ART, or rather retroviral drugs. So we had to find ways to import these drugs from Germany to be able to send to the lady in prison. Because in that country, I'll not name the country, talking about HIV/AIDS is a taboo. So if you find somebody saying that I have HIV, it's unlikely that that kind of person will be assisted. Next, please. Still on challenges, of course, we continue to have structural challenges as well as legal barriers. I have talked about LGTB, or people who are people of the same, who have sex, men having sex, for instance, with other men. We don't talk about that. Sex workers, we don't talk about them. And so we continue, or our laws continue to criminalize this group of people. And that is where we have the challenge that we need to deal with. Of course, we continue to have gender inequality, not only on people with HIV, but other groups as well. Next. Of course, managing or dealing with HIV is an expensive venture, and we continue to work through various institutions, through policies, to ensure that we bring down issues of S&D as well as the general discrimination. And then, of course, uneven distribution of health centers. We don't have sufficient health centers. We don't have enough infrastructure. Again, I've mentioned the punitive laws and some of the policies that we need to deal with, that we need to reform to be able to make sure that everyone accesses health. Next. I've already mentioned about illegal police harassment or police practices, and then mandatory HIV testing. We have not mentioned mandatory. We don't force people to do it. And then there are certain areas where there is lack of clarity around the legal framework for people who are under 18 years and are transgender. Sometimes we have children in school who are transgender and they don't know which toilet to use, for example, whether they go to the boys' toilet or they go to the girls' toilet. Even in the offices, we have such people and they don't know where to go. So we have noticed a stage where we need to have specific toilets for transgender children in schools. Next. So how do we manage HIV/AIDS in Kenya? We have the HIV and AIDS Prevention and Control Act of 2006. It was revised in 2012, and we are revising again today to be able to deal with some of the challenges that have emerged as a result of implementing the policies within this act. So what does this act do? This act provides that we engage in education in schools, in public places, in public meetings, in the community, within the families. For instance, today in Kenya, from primary school to high school to university, we teach HIV and AIDS. We teach on issues to do with HIV and AIDS. We teach on issues to do with discrimination, as well as stigma, to be able to grow a new generation who would ultimately become the leaders tomorrow and be able to deal with some of these issues to do with S and D. And then safe practices and procedures on all matters dealing with testing of donated tissue, blood, surgical, and similar procedures. We have penalty for those who deal with such issues without the proper law. And then test screening and access to health care services. It's not compulsory. If you have to test someone, you must give the consent. Next, please. This law also deals with issues of confidentiality, policy guidelines, confidentiality of records. According to our law, if the doctor diagnoses someone with HIV, they are not supposed to share with anyone without the consent of that person. And then on issues of disclosure, also don't disclose information, transmission of HIV. Any transmissions of HIV knowingly attracts a fine of $500,000 or $5,000. That is, if you know that you have HIV and you engage in for example, in unprotected sex because you want to kill that person, then you attract a fine of $5,000. We have had cases in Kenya where some sex workers, women in this case, have had to, or even a lady who has been diagnosed with HIV, because of disagreeing with the husband or the friend, has gone on an infection spree, inspecting us. At one time, there was one who said that she has infected as many as 100 men. So she just wants to kill as many as she can. So we have such cases. Probably this is someone who went through discrimination or stigma and wanted to revenge. Next. Prohibition of discriminatory acts and policies. We are working, as I said, we are revising this act so that we can remove some of those discriminatory policies that do not allow us to speak about homosexuals or people who are transgender. And then the penalties there, if you violate any of the policies. Next, please. Besides the act, we have a tribunal, and this tribunal was established within that act to hear and determine complaints and appeals arising from the breach of the provisions of the specific act. That tribunal is active and has been able to deal with so many cases that have come up as a result of either failure to implement the act or police have not been able to adhere to the provisions of the act. Next. Of course, the Kenya Constitution 2010, which is a very progressive constitution, has a huge, speaks quite a lot or promotes human rights. And one of the issues within our constitution is that everyone in Kenya, including foreigners who live in Kenya, must get the highest standards of public health as possible. That one is very clear within our constitution, and specifically in Article 27, every person is equal before the law and has a right to equal protection and equal benefit before the law. Because of this new constitution, We have had so many cases in court being successful. Many people affected or living with HIV AIDS. Because of this new constitution, our judges have been very firm on ensuring that those who are affected are, or rather are paid, or they get the benefits that go with the level of violation of their human rights. Sub-Article 4, the state shall not discriminate directly or indirectly, especially on matters to do with public health. So public health is covered very well in our constitution. Next. And even in Article 28 on human dignity, it is inherent in our constitution, is respected and protected by the constitution. And because of this, many people have been punished for violating the human rights of people living or affected by HIV. Next, please. Some lessons there, some strategies that we have employed. We have employed what is popularly known as all government, all society approach, where everyone is involved. Our approach under the Kenya AIDS Strategy Framework 2, everyone is involved. It is a centered people, it's a people-centered approach, and we have already succeeded in reducing S&D from 44 to 23 under the Strategic AIDS Framework 2014-2019, and then we have a new one, 2020 to 2025, even as we work towards achieving the 2030 goals of a healthy nation. And then we have made an effort to talk openly about HIV. In 2001, for example, or 2000 there, people were still hiding their children or even their wives or husbands affected by or infected by HIV. But today we speak openly about HIV in public, in the families, in schools. So it's an open thing. And we believe that if we continue speaking, then issues of S&D will go away. And then there's a lot of training of healthcare workers, including those in the villages, and on matters to do with human rights, as well as people living with HIV. And then extensive training targeting paralegal and pro bono lawyers who support HIV-related cases has been undertaken, so that we are very strong lawyers who can take up cases for people living with HIV/AIDS in courts, and we have had so many successful cases. Next. Is that the end? No, that's not the end. Yeah, key achievements and then way forward. So what's the way forward? I've already mentioned that we have had a successful implementation of the KASF1 2014-2020, in which we have managed to reduce S&D from 45 in 2014 to 23 in 2021. The war is still there. We have not succeeded, and we can only succeed if we partner with people like you or institutions like yourself. And then, so under the new KSF2, which is already in operation, we recognize targeted interventions for the specific groups that I've talked about: sex workers, transgender groups, adolescents, or people between 15 to 49 years, as well as men who have sex with men. These are issues that we are beginning to talk about openly, although I've mentioned that people are shy to speak about this, but we have a growing population of this group, and we need to target them. No one is safe unless everyone is safe, regardless of their agenda. Okay, last point. Anything else? Next. Yeah, those are some of the things that we intend to do under the new program from 2020 to 25, and of course under the Kenya Vision 2030, strengthening the health system in cooperation with partners. At this juncture, I want to thank Thailand for the cooperation that we have had with them for a long time on matters of universal health coverage. Thailand is a very strong partner for Kenya, and we have succeeded because of that kind of partnership. And of course, UNAIDS, the UN, the African Union, and the East African Community. We also intend to step up something called Vmmc, Voluntary Medical Male Circumcision. Let me just mention something about this. In Kenya, we have certain communities who don't circumcise their male. And it is these specific regions that have had the highest infections of HIV. So what have we done? We have encouraged these communities to have their male their boys to be circumcised. Their men and their boys to be circumcised. Because scientific research has indicated that close to 99% of the chances of getting HIV will be eliminated when you are circumcised. That's for the men. So we are stepping up that, and we have done very well. We are moving towards around 90% of encouraging our men in those communities to do Vmmc. And then we are also now providing self-testing. Just like we are doing self-testing for COVID-19, we are now providing self-testing to encourage people to self-test. Although the kits are expensive, we are thinking of probably even giving them free so that more men and women can come forward. I've already talked about targeting the specific communities, which I have mentioned. And then even for those who inject themselves with drugs illegally behind the curtain, we are encouraging them to come forward under what is known as needle substitutions programs, NSPs, and opioid substitution therapy. We are encouraging them to come out so that they can inject this. Of course, I'm not saying that illegal drugs, those who engage in injecting themselves with illegal drugs will come forward. Of course, they will not, because some of these drugs, like marijuana, is still illegal in Kenya. But recently, one member of parliament took a bill to parliament to legalize marijuana. So probably at that point where we legalize marijuana, that some of these folks can come forward. Yeah, we're also targeting young people, especially girls. We have a high rate of pregnancy for young girls between 14 and 18 years. And the fact that we have so many getting pregnant means that they are not taking care of themselves. So we're also targeting this population. If we can encourage them to abstain and or even use condoms. So the condom policy is also, is also being elevated in Kenya, where we provide condoms everywhere, even in the office, in the toilets, in the office. We put condoms there in case you need any, you pick. So we are trying to make condoms accessible to everyone as much as possible. Yep. Next. Next is thank you.
Thank you very much indeed.
Good. Thank you very much.
You can say. For those who participate through the virtual mean, please feel free to put your comment and your question if you have any on the chat box, and we will manage that. What I learned from His Excellency Captainess in three things. Firstly, thank you for sharing the story and the number of the real situation, particularly on S&D. And in particularly, very the supportive message about how important is social support to address so meaningful in a vulnerable situation. And that is the first-hand witness that His Excellency showed us. And secondly, we need, in addressing S&D, we need to address both soft and hard side. About taboo, about social culture, that is soft side, and about the hard side. We learned from Kenya about the very advanced progressive law on HIV/AIDS, and it is still improving over time. And in particularly the justice system about the HIV/AIDS tribunal system, that is to address the issue of legal environment of the issue. That is the real hard side. And thirdly, amidst of many limitations, talking about infrastructure, the implementation, the lack of clarity, we have seen the concrete evidence of the benefit that Kenya society got. In particular, is number don't lie about the decreasing of the stigmatization number in Kenya. And if S&D is on one side of the coin, the other side is on inequality and human rights violation. So that is a clear message, and you talk about the partners. So now from Kenya, let's move to another important country, the important country in the term of global response to HIV. With us, it's Mr. Joel Harding from Deputy Ambassador from the British Embassy in Thailand. Why so important, Joel? Why S&D is so important? I know about the S&D and gender inequality is so big issue from British Embassy, and I share with you the real the first-hand witness During the last year, when we have a hard hit with the COVID-19, British Embassy support the community-based organization in Thailand to address this issue. When people talk about COVID-19, British Embassy kindly addressed this almost neglected at that time issue about this S&D among people living with HIV and key population. Now come to my question: why so important? What is your perspective on this?
Yeah, thank you. Is that on? Yeah. Thanks very much, Dr. Taksapon, and Your Excellency. Thank you for those remarks. Particularly good to hear your personal experience and some of the reflections from Kenya and some of the real difficulties in the struggle against discrimination and stigma that you've been working on, and inspiring to hear what you said. And good afternoon to everyone. Very happy to be in this seminar and in this panel. So, I mean, first off, I want to start by commending Thailand on its chairmanship of the Programme Coordinating Board this year, and on your role as Vice Chair last year, and particularly in that all that hard work that culminated in the Global AIDS Strategy for 2021 to 2026, which I think is a fantastic way forward. And I mean, whilst that acknowledges that there are huge challenges ahead, I think it's also worth reflecting on the fact that we have made some remarkable progress, and globally there have been impressive successes in HIV testing and treatment. At the end of 2019, 81% of people living with HIV knew their HIV status. More than 2/3 were on life-saving antiretroviral therapy. That's 26 million of the 38 million people living with HIV, and that's tripled since 2010. So there has been some remarkable progress, and we should celebrate that. But obviously, despite those successes, there are really, major important gaps. And 25% of people living with HIV are still not on treatment, and it's still an important global crisis that needs our attention. New HIV infections remain high and are increasing in some countries. The new strategy is really important in targeting the resources where they're most needed, and the UK particularly welcomes the lens on inequality and as a key means of focusing attention on the areas and groups that are being most left behind or most marginalizing, and focusing our efforts, our finances, our energy, and our community mobilization to those who are at the margins and are not receiving the kind of support or access to services that they should. So if we're going to reach our goal to end AIDS as a public health threat by 2030, we're going to have to step up our work, and the UK remains very much in support of the work of the Programme Coordinating Board and through the Global Fund, and as well as our support through the Robert Carr Fund to support civil society, which is obviously at the grassroots, where all the really good work happens. So really important that we maintain and work towards the 95 targets. But we need to make sure that they are achieved in all populations, and we really appreciate the strategy's focus on reducing inequalities and ensuring that we all work to this goal. So, I mean, just to say a bit more about the UK's global role, the UK also welcomes the focus on addressing the structural drivers of HIV infection and AIDS-related deaths, and particularly the barriers to services due to stigma and discrimination that His Excellency was talking about, and also criminalization and the impacts of criminalization on stigma and discrimination. And that's reflected in the new Global Fund strategy from 2023 to 2028. Discriminatory and punitive laws and policies are still major barriers with access to services and the well-being of people living with or affected by HIV. And we really need to use the full complement of tools at our disposal in addressing human rights violations and stigma and discrimination against these key populations and others. So within that, the UK is really firmly committed to the work in combating violence and discrimination against LGBT plus people. And this forms a really important pillar and part of our wider international human rights work. We continue to defend and progress sexual reproductive health rights and take a human rights approach to doing so. So linked to this effort, I just wanted to also draw your attention to the fact that the UK will host its first ever global LGBT plus conference, which is called Safe to Be Me. And that will be in June 2022, which coincides with the 50th anniversary of London Pride. And we're really looking forward to that event. The conference is going to bring together governments, parliamentarians, business and civil society experts to secure new commitments for positive international on LGBT plus rights. A main aim of the conference is to increase public services for LGBT plus people with a focus on health and HIV. So there's a really strong link across to this agenda. I just wanted to say a few more words about Thailand and what we're doing here as well. I'm so pleased to see Thailand's leading role and commitment as the chair to advance the efforts of reduction of stigma and discrimination among people living with HIV. Thailand's efforts through its system-wide intervention to reduce stigma and discrimination in healthcare settings and the thriving civil society movement in Thailand underpins the work and means that actually Thailand has a really good story to tell and really good practices to share with others in the region and globally on this issue. So locally, as Dr. Taksapon talked about, we're supporting the Rainbow Sky Association of Thailand, carrying out a research project on equitable access to healthcare services, allowing LGBT plus people to receive treatment that meets individual needs. And there will be more work in Thailand in the future. So I'll just close by just a huge thanks to the Ministry of Foreign Affairs and the Ministry of Public Health for the opportunity to be part of this panel. And look forward to our continued cooperation both here and globally. Thank you very much.
Thank you very much, Deputy Ambassador. So he point out two main messages. Firstly, is that to ending AIDS, to making HIV/AIDS as a history in terms of public health threat, so we need to address the inequality, and this is we need to drive to act together toward this global goal, to as global achievement, and then you can show us that the country can contribute a lot to the global response to HIV, including the Global Fund, and making Leave No One Behind as an actionable promise. So it's not just a gimmick for, say, leaving no one behind. I mean, we do business as usual. We need to change our mindset to drive this action forward. And secondly, to the human rights lens. And when we put the human rights lens, we can see things differently in terms of this barrier, in terms of this punitive law. And then we look forward to the Global LGBT Plus conference in June 2022. So this is quite in the close time of the next PCB meeting in June as well. So I hope that this can complement to each other. So from government, now we move to the intergovernment agency. Let's hear from Mr. Taufik. Taufik, UNAIDS has been mentioned many times for today. Why is so important about S&D? Why is S&D so important in terms of the global targets in the new global AIDS strategy? And so to the SDG, what is your view? Do you share our situation and trend of is this achievable? This target is too ambitious, or is it achievable? And what does it mean when we achieve this? What does it bring to the global population? Yes.
Thank you so much. And let me join excellencies for congratulating the Royal Thai government for organizing this event and for their shown leadership. As now they are taking over the chairmanship of the PCB, but also the leadership on the HIV response in general that we have observed and we have been proud to be partner of in Asia and Pacific and globally in general. This is a key element that we are discussing about, and a core pillar of the global AIDS strategy. We have heard excellent examples during the two previous interventions that highlights the different aspects and different forms of stigma and discrimination, how it is affecting the lives of people living with HIV, but also the lives of the communities and the populations who are vulnerable to HIV. When we talk about stigma and discrimination, we don't talk only about HIV population. We talk about all those who are vulnerable. The situation here is that we are seeing different forms of stigma and discrimination that are met by these populations with regard to either their inherent stigmatized health status, particularly when it is linked to tuberculosis infection, for example. The second element sometimes is in relation to their choice and behavior and the sexual orientation. That's what brings in the key populations. But sometimes it's it's hurtful to see that stigma and discrimination is associated to simple identity-related aspects beyond the gender-related identity, but binary gender, being a woman, being a young person, could be a source of stigmatization. And these things need to stop. Without resolving these issues, we cannot meet the global AIDS strategy, and I'm going to explain why. Those different forms of stigma and discrimination, they impact on people's access to service in different ways. And when we talk about service, yes, we prioritize the HIV and health-related services, including SRHR. But its impact on all kinds of services, including access to social protection, access to housing, access to education, justice, and everything. And that's what exacerbates the level of inequalities that are inherent at the core of the HIV epidemic. The Global AIDS Strategy recently has strongly highlighted this point and highlighted what needs to be addressed. Now, back to your question, why it is important to address it is because we have seen evidence that when you have stigma and discrimination, the programmatic targets, the 95, 95, 95, 95, all four of them, starting from prevention, cannot be met. It's really important to achieve the other complementary targets about the enabling environments, which has about the laws and the policies, stigma and discrimination in the communities, and the violence against women. These three components need to be resolved, and they complement the ability of service delivery models and the national efforts to remove the barriers and make people being able to access the different services. And this way, we can aim to see the ending of the epidemic as a global health threat. This is achievable. We have seen countries who have found ways towards reaching those targets, or at least find solutions when the criminalization aspects and the laws and policies aspects are hard to change in a very short term. There are practical solutions that are informed by science being implemented in the field. And I recall the opening statement from our Deputy Executive Director when he mentioned the laws in the books and the laws on the streets. A quick example to mention that key populations are criminalized in the majority of countries in Asia and the Pacific. But the strongest key population programs and the most effective are happening in Asia and the Pacific. One would ask the question, how can you provide service delivery for criminalized populations? It's because there are solutions that have been in place. It's because of the engagement of the community. It's because of partnerships between health and the different populations and categories, including young people, community organizations of all kinds, to help find those solutions to turn around or to resolve the stigma faced. Now, still, this is not completely resolved here in Asia and Pacific. We still have very high levels. And if I quote to one study, which I had read recently, is that on average, people who access testing, about 30%, one-third, 33% of them have delayed access to testing, have delayed availing testing for fear of stigma and discrimination. That tells us that there is a long way ahead of us that needs to be resolved. from the policy and laws perspective going all the way down to the practical aspects. And this will call for first having correct evidence. And unfortunately, in Asia and the Pacific, we do not have many countries report national values on levels of stigma and discrimination. Who was the first one? Can I have a guess? The first country in Asia Pacific reporting on the GAM, Global AIDS Monitoring Indicators on stigma and discrimination, was Thailand. And others are following. Second one is Malaysia. And I'm aware right now from my position of a lot of work that is happening on implementing studies and surveys to allow for people to at least have proper measurements of different levels of stigma discrimination beyond the stigma index, but different methodologies that allow to identify and measure the different layers of stigma and discrimination beyond being affected by HIV. What's the additional layer when you are young? What's the additional layer when you are a man having sex with men? What's the additional layer where you are a sex worker and injecting drugs? And these are core elements that need to be understood so that we can find solutions.
Thank you very much, Tawfiq. Can I have following on the question? And for this year, UNAIDS talk about to remove the laws that harm and then create the laws that empowering. So what is the action part that countries should do to address this one? Can you further materialize it?
Yeah, and this is very pertinent. And let me just give an example. Start the response by referring to an example when initially, in the early days of the global AIDS response, when the criminalization of HIV transmission has taken place, it was with the intention to protect those who are not infected from being infected. That was the intention, but now we realize that it is having a counter effect completely when people tend to avoid knowing their status, or when they know, tend to avoid reporting it, so that they don't get into this situation of being criminalized. And it has a counter effect from that intention. Now, laws and policies are really important, and we can see from the range of the laws and policies. We have the most complicated one, most highly sensitive, like when you talk about criminalization, versus the laws and policies who are supportive of service delivery, as simple as, Ika, you're next to me, as having policies that allow for young people to avail HIV testing without parental consent, or avail accessing normal SRHR, sexual and reproductive health services in health clinics with all the requirements that are needed. And those enabling policies are needed. It's not only to say we are giving a policy that imposes fines if somebody does something, but we need a solution to avoid. We need policies that empower, policies that help in finding solutions, policies that do not criminalize or that do not impede of people in accessing services. And this is the theme of the event today.
Yeah. Thank you very much. So we learn a lot from Tawfiq. Tawfiq talk about anything on my note. And this is three groups. The firstly, S&D is not only the issue about individual, but it's about the health and well-being of collective level, perhaps as a society. And HIV-related S&D is a good proxy or good tracer to show that how inclusive the society we have. It has this is reflect many of other vulnerable setting, other conditions that we have, be it hepatitis or even COVID-19 as the current. And secondly, we need multi-sectoral, whole of government and whole of society solution. We cannot touch on only one side. Let's say I'm a doctor, I cannot touch on healthcare side, because healthcare side, stigma and discrimination is one part. There's other education and workplace and community. And this is only the tip of the iceberg. The under is the social mindset, and perhaps the law and legal environment is the one core of the enabling environment that we are talking about. And the third one, Now, it's very important, in particularly in low and middle country like implementation. We have good policy on paper and how good it is. People say that policy is only as good as it is implemented. So this is so true. We cannot make that good policy change, good law, but not unimplemented or unenforced at all. And this topic also shows us that another highly unacceptable number about the delay of treatment to access and test. So this is even in healthcare, and it's we a little bit embarrassing on this number, because we advocate among health sector, among doctor and nurse and other health professionals for long, for even since 1990, that we should have no tolerance for the S&D. Now move from UNAIDS to Harry, from our leader in the civil society organization. Harry to join us from the virtual meet. Harry, Prabhupada Asia Pacific Network of People Living with HIV/AIDS. Harry, are you with us?
Yes, I'm here.
Okay. From your point of view, what is the situation? What is the real life experience? And what should we do? What should the world do? The government, the intergovernmental organization, the international agency, the partners, the country, the community. What is on your wish list?
Okay. Okay. Thank you, Dr. Sapon. First, I try to following with what His Excellency said, and then also the Deputy of UNAIDS. I would like to congratulate Thailand for becoming the chair of this PCB this year, and then I also would like to say thank you to Ministry of Foreign Affairs of Thailand and the Ministry of Health of Thailand for inviting me as one of the panelists of today's high-level webinar. Excellency and distinguished participants, before I start to answer the questions, please allow me to introduce my organization just briefly. So basically, IPM Plus is a regional network of people living with HIV in the Asia Pacific. We established in 1994. Our mission is to develop a collective response issue faced by PHIV in the regions, linking with the global platform and support country-level action by PHIV. With mission is PHIV are able to enjoy better quality of life, free from stigma discrimination, access to optimal HIV and co-infection treatment, regardless of our financial situation, sexual orientation, drug use status, and occupation, and our membership from 30 countries in the region. So to start with the conversation, I think I would like to reiterate again with the topic as we mentioned, and like, you know, when we talk about this issue, we have to revisit again the tremendous progress made by the HIV response so far by using the evidence base, evidence data provided by UNAIDS. As per today, HIV response globally has shown that antiviral has been scaled and become the primary contributor to 48% decline of the number of people dying from AIDS-related causes. The data is also reiterated that HIV response globally has been proven to strengthen the HIV prevention and treatment programs and reduce the transmission of HIV. Nowadays, people who acquire for HIV has declined by 16%, but nevertheless, this progress gain are not distributed equally across countries globally. We know that people living with HIV or affected by HIV often experience intersectional form of stigma and discrimination, where the experience mostly happen based on gender, race, disability, ethnicity, age, sex, drug use, sexual orientation, migration status, and several other factors that distinguishes the difference of a person from other groups of people. And one of the key findings from the Stigma Index aggregated data in 19 countries, which also represent about 23% of PHIV globally, 1 in 5 PHIV is being denied by health services because of HIV-related stigma and discrimination. Again, we all know that removing barriers of stigma discrimination, it will enable people who left behind to access HIV prevention, testing, treatment, and care services. And let alone is also become one of keys to ending AIDS as a global public health threat, and it will help countries to reach the universal health coverage and achieve the Sustainable Development Goals. Because of that reason, there is also an urgency and need to address inequality that's still underpinning stigma and discrimination and embed laws and policies. There is also need to reintegrate the political commitments by member states, the United Nations, the civil society organization, and the communities to end age-related stigma discrimination through a global initiative. Which now we have the global partnership to eliminate all forms of HIV-related stigma and discrimination. I know it's a long name, but these words are clearly emphasized that we want the global HIV response is able to achieve the HIV target and reach the 10-10-10 target by 2025 and by 2025 to end the HIV. 2030 to end HIV. So the global partnership is an initiative that is aimed to accelerate the implementation and scaling up the programs and initiatives to end all forms of HIV-related stigma and discrimination. The global partnership is also to see data gaps and inform policy programs that enable demonstrate measurable progress toward elimination of HIV and related stigma and discrimination. The global partnership also addressed the critical cost-cutting dimension of stigma discrimination faced by population left behind that include harmful gender, social, cultural norms and practices, sexual and gender-based violence, legal policy environments, the impact of gender, socio-economic inequalities, social protection policies, communication and the media, and the internalized experience of stigma. Under the global partnership, there are 6 settings of action that need to be focused on, which is healthcare settings, workplace settings, educational settings, justice settings, individual household and community settings, and emergency and humanitarian settings. You must be wondering why this setting has become a priority action. Because this setting where stigma, discrimination, and violence occur, including intersectional discrimination. In these settings, will enable stakeholders across all levels address sensitive issues and increase the chance of political and financial investment to create stigma-free HIV response. And lastly, in these settings, various UNAIDS co-sponsor and key partners like Global Fund, PEPFAR are already leading their works in their global part areas in the setting of action. So we need a global partnership because it will help stakeholders across the level to better understand HIV-related stigma discrimination and its manifestation towards the HIV response. Back to you, Dr. Taksapon.
Thank you very much, Harry. So Harry point out the very key issue on, firstly, I think this community action and community-led action are essential for our collective effort for the way forward. And he point out saying that actually the inequality and S&D, so this is the two sides of the same coin. These are silent killer. Of course, people say that it is disease that kills people, but this S&D and inequality slow people from access to care, and actually there's a part of the killer. And we have to look at this issue in both in terms of condition and setting. And the one setting that we talk about is the humanitarian setting. And also condition is not only about the occupation or sex worker or LGBT, but also migrants issue. That's another big issue. When you say migrant, it's not only about the foreigner come to one country, there's also inside the country. And the COVID-19 pandemic show us that is the urban poor who are migrate from urban side to Bangkok are the most vulnerable in this. I think this lesson learned can be applied to HIV as well. And lastly, we need global. As Taufik said, that the 95 is the goal. S&D is the mean. Tackling S&D is the mean. And perhaps a global partnership is the powerful platform together with Global Fund and other partners to join this as can be a meaningful action to address S&D at a global scale. And now, from the current, can we move to the future? I'm talking about Ika. And those who have comment and question, please prepare. After Ika, I will open the floor. Ika, as from Youth Lead Asia Pacific Network of Young Key Population, and you are the future. Can you help us to imagine what's kind of the world free from stigma and discrimination that you would like to see, and how we can achieve it?
First of all, thank you so much for having me here. So I'm so nervous today. Please let me introduce myself first. My name is Ika Novianti. I'm originally from Indonesia, but now I'm working here in Bangkok. So the question is like, what kind of society without stigma and discrimination would I like to see, and how? I guess a society without where everyone would be happy. That's the really what I'm imagining, without the stigma and discrimination. So we wouldn't have to worry about being ourselves, about our status, and about who we love. We wouldn't see the HIV increase, the HIV number rise, because of the young people would be so open talking about the HIV and getting tested to the healthcare worker, accessing services and being open of their status. It will be the change the HIV landscape in the future. What we need to do is to increase the advocacy effort and work in collaboration with the hospital, school, and the government to promote the positive messaging. Because currently we've seen a lot of young people receive the stigma and discrimination from school, especially young key population like young LGBTQ, young people living with HIV, and also including a misconception about the HIV. U equals U, and encourage young people to get tests. Getting tests should be feeling like a normal thing to do, but there is so much stigma attached to it, and it needs to change on the school and in the healthcare setting, and also in the workplace. Young people are not getting tests not because they are afraid of the results. They are not afraid about they might get the HIV, but they are afraid when people discriminate them in the HIV with this the HIV setting. So, yeah, I think that's all from my side.
Thank you very much. So, it can help us to imagine, draw the rough picture of what is the world without stigmatization, and into that everyone feel happy and can be happy to be yourself. And I think that's have to apologize you, Ika, that my generation haven't done enough to make the world as an enabling place for your generation to grow and to thrive. But we will drive forward. We will not surrender by this situation. And perhaps our playbook, our current playbook that works so efficiently in the past might not work as efficient as for the future. We cannot be static and use the same rule and the same intervention all the time. Now it's time to open the floor for those questions and comments from the floor. I've got my note. I have two. Please, if you are in the room, there's the microphone over here. Please, if anyone would like to, yep, please. How can I say it? Okay. Please introduce yourself and then followed by your question or comment.
Thank you. My name is Midnight. I'm the Executive Director of APCOM, a regional organization working with gay men, other sex men, and also with people of diverse sexual orientation, gender identity, expressions, and sex characteristics in the region. I'm also on the NGO delegation on the UNAIDS PCB program coordinating board as well. So congratulations to Thailand and also UNAIDS for providing this high-level seminar on ending AIDS, Zero Discrimination, One World. And it's really nice to see the leadership going forward on the chairmanship on the UNAIDS PCB. Yeah. Just to continue from what really Harry and Ika were already mentioning about, bringing the voices from the communities into these kind of spaces, particularly seeing key populations as people, and people living with HIV as also having humanity as well. In the Asia-Pacific region, 98% of all new HIV cases are amongst key populations and their partners. The Global AIDS Strategy also estimated that we need for our region 32% of all the global resources so that we can be on target by 2025. However, we are also seeing that there is reductions in this region, particularly to key population-led interventions. And the speakers already mentioned about how important and critical it is to really tackle discrimination and stigma and also structural issues. So I'll just give maybe three reflections in terms of what we should also be looking at around investment for our region. First of all, it's around investing in key population community organizations as provider to provide comprehensive services. So we're talking about education, we're talking about prevention, treatment dispensing, and also initiating in community-led spaces. Because effective key population-led programs also address stigma, discrimination, and violence by engaging with key population leaders and building key population competency in the region. So as we know, we need to dramatically increase the spending on HIV prevention. That includes pre-exposure prophylaxis for our region. We also want to ensure that people get easy access to HIV testing. How do we bring down the barriers towards HIV self-testing in our region? Ika talked about the scaling up and also ensuring that key messaging for key populations, particularly on undetectable equal untransmittable equal untransmittable, or U equals U. But we also need viral load testing coverage for our region as well, so that people who wants to know and be on treatment can get those services. Governments in our region also need to invest in core community capacity development and structural interventions. So ensuring that highly marginalized key populations can also address on advocacy around ensuring that these spaces we have the communities that in our hearts. And then lastly, to invest in the sustainability of the key populations-led responses. I mean, it goes without saying that we're already exploring in our region around ensuring how do we have domestic finances to key population-led interventions. We've seen so many of the wonderful work, particularly for Thailand, that has done that, and I hope that we can also see that also increases in this region as well. And then lastly, we want to be working in partnership with the Thai government and also governments in this region, together with key population regional networks, in partnership with UNAIDS and also other stakeholders, to ensure that we not only profile some of this very innovative work that we're doing in this region, but it's also to ensure that we remain steadfast and strong in terms of the global advocacy around this kind of wonderful work we're doing in this region.
Thank you very much, Khun Vinay. So I got a note that there will be a request from the floor from the virtual by my colleagues, Dr. Mukta Sharma. Hello, greetings, Mukta.
Sawadee. My
Please.
greetings to the distinguished panel and all colleagues in Thailand. This is very exciting and it's been very instructive to hear the panel and also hear colleagues talk about what we can dream about, what the future can look like. And one thing I wanted to do was perhaps invite us to consider that stigma and discrimination are two distinct but interrelated ideas. One is socially constructed, the other is legally constructed. So, when you talk about social construction, we're talking about otherness or very subtle internalized stigma. When we're talking about discrimination, we are talking, for example, about a human rights abuse. We all have heard these horrendous stories of women being chained during labor if they're HIV positive to their beds. That's very clear discrimination. I think we need to really start focusing on understanding these as two distinct areas and not lump them together as one, because this is such a huge area of work. And if we lump it together as one, the risk is we don't really make progress on very much at all. And that has certainly been something we've been frustrated with having worked in this field for such a long time, we're making very little progress. Now, where we are making progress is in the law arena. And I wanted to share quickly with you that there are very good examples of how laws have changed in our region. Let's start with Thailand. Thailand recently decriminalized cannabis. Who would have thought that would be possible 10 years ago? But it has happened. India has the Hiv-Aids Act, which very specifically focuses on addressing stigma and discrimination in the workplace and in the education sector. Bhutan, India have decriminalized same-sex relationships. They have recognized the third gender. Myanmar in 2018 said that no more compulsory registration of drug users. Drug users will be seen as people who need treatment. So I think the need to focus on laws and the implementation of those laws is something that we really need to be looking at very discreetly while we work on the issues of gender, while we work on the issues of how people perceive intimate relationships, while we work on the bigger issues of structural violence. The last thing I wanted to say was, and Tawfiq talked about this a little bit, second last thing actually, is the whole issue of thinking about addressing stigma in a more broader health system framework. You have stigma and discrimination for epilepsy, for obesity, for mental health, for leprosy, for tuberculosis, for hepatitis. And there are not very many countries now where HIV/AIDS programs stand alone. So what we do need to be looking at is the wider health stigma discrimination framework that was put out in 2019. And I think this is something that we need to be looking at, even if countries are not reporting on the AIDS stigma index. Countries could think about implementing a broader health system response to measuring stigma and discrimination. And lastly, just very quickly, I wanted to say something about U equals U, which is undetectable is equal to untransmittable. This is something which is really, really important, and we don't talk about it very much, because if providers, if people understand what the science is actually saying, that you cannot transmit if your viral load is undetectable, that will make a big difference. And I'm wondering really how many doctors and nurses, how many people who are living with HIV and their families understand this, and whether this could be a really key area of work going forward to focus on for all of us. I'll stop here, Khun Mek. You've been very generous in giving me my 2 minutes. Thank you very much.
Thank you very much, my friend Mukta. If there are no other question or comment from the floor and from the comment, we have one comment from Tom Sadin. Please give me apology if I pronounce your name wrongly. About the Kenya, I will ask His Excellency to address that part. So thank you very much, Good Midnight, and Dr. Mukta also talk about the community and also about the broader framework of not only about HIV-related stigmatization, but this is the part of the bigger framework and the issue of lesson learned from each other. I think we can promote this knowledge and experience sharing mechanism across country. We learn a lot from Kenya today. And lastly, both touch on the issue of U equal U. So that is to be carefully translation into implementation and clarify with the whole society. So let's come back to the panelists for the last round. You each have 1 minute each. Can I start from Ika? Ika, what is your take-home message and what you would like to call for action to others, including this government, the intergovernmental agency, and others to act, please?
Thank you. So my call to action for today's meeting is to treat young leaders and young people working on the HIV as equal partners, not just as a beneficiary of the programs. I'm searching for saying this. Like many times we work with adults, we are never seen as equal partners. But we have skill, the knowledge, the experience, the connection, and the leadership to make a strong impact. Young people also don't have enough space in the decision making, and this needs to change. For example, we need young people, young key population in decision-making bodies like the government, the CCM, even the UN agencies. This will help guarantee their needs at the front and the adults care what they have to say. How we can talk about the reducing HIV infection among young people if they don't have space to raise their issue? Yeah, we are not ticking a box, and we need more meaningful engagement. Thank you.
Thank you very much. Before we go to Harry, so you talk about the equal foothold between young population and the other, and youth are not only those concerned, societal concern, not only a beneficiary of the game. You are the driver of the game as well. So thank you very much, Ika. Can you go to Harry? Harry,
Yes.
what is your take-home message? What is your actions?
Okay. Saying as the political declaration on HIV and AIDS is adopted and signed by the member states, and then we also have the new global AIDS strategy, where this momentum is very emphasized inequality and HIV-related criminalization. So again, I guess it is time for countries to put their effort to work on inequalities where stigma discrimination is still embedded. There is a platform that we can use to work in this regard, which is Global Partnership to Eliminate all form-related stigma discrimination. Since if we were to work together on this, we will able to achieve the 10-10-10 target by 2025 and AIDS by 2030, and it will help countries to reach the universal health coverage, also the SDGs. Thank you, Dr. Sopan.
Thank you very much, Harry. So please accept my apology. I missed one. Sorry, so small. And I think on the floor we have Mr. Pete Pitivat, who also his story is also shared in this Zero Discrimination Day as well. Pete, can you deliver in 1 minute? 1 minute.
Okay. Hello, do you hear me? Yeah. Okay. My name is Pete. As a person living with HIV from Thailand, I also in the panel task force Stigma Index from Thailand as well. As a representative from youth living with HIV and people with just drug as well. I would like to share about the strategic plan to improve about the stigma discrimination about two things. One thing I would love to see more people living with HIV to be a representative every aspect of the society, like a doctor living with HIV, a nurse living with HIV, minister living with HIV, like that. And I would love to see many people living with HIV there to encourage to disclose themselves to be known by the public. More than that, that is a good signal to be seen. And another one is I would love to see more promote about the zero discordant couples or zero status couple, which is one partner is HIV positive, undetectable, another one is HIV negative. That we would love to show the public that people living with HIV and people who have no HIV can live together, can stay in the relationship together, can give a birth a child and raise a child without HIV as well. This is so really key, important to promote, to reduce stigma and discrimination in society as a whole. Thank you so much.
Thank you very much with your voice heard, particularly about the role model as well. We need many more role models. So now go to Joel, please.
Yeah, thank you. So the last mile or the last bit of road is quite often the hardest bit of road to cover. And there's still a huge amount to do if we're going to meet the goals that we set out, both in the global strategy and also by 2030. And those goals require institutional change. They require systemic change in a lot of different ways. And that type of change will be really different depending on which context, which country, which locality you're in. And in my opinion and my experience, the only way that you can really change institutions and reform is by listening, properly listening to people like Pete, to activists, to people who are living this experience, and learn from them at a very local level, at a kind of subnational level, at a national level, and understand those experiences and use those experiences to develop policy and to drive forward reform. So if there's one thing that I want to leave you all with, it's just to listen, understand, provide the space, provide the platform for people to talk about their experiences, the barriers to access to services, and use that to drive forward the reform and make sure that it's bottom-up reform. Thank you.
Thank you very much. Also, so clear. Deep listening, understand space, platform, and mechanism. So, His Excellency, Your Excellency, Happiness, please.
Thank you once again. I have team here with me with some tough comments here or questions. So I hope you'll give me more than 1 minute. But team, let's do it together. Let's clarify some of these issues together. You are the expert. On the first issue about deliberate transmission, yes, I do agree that when that lady was telling us or telling the whole country that I have infected 100 men, indeed, criminalization of transmission does more harm to, or rather, it leads to increased discrimination than it does to prevent transmission. But what I may ask myself, or you may ask yourself, is if a certain lady wakes up one morning and does not disclose her status and goes out and says, today I'm going to kill 100 men. So she goes around sleeping with men up to 100. And you're one of those men. And she comes out to say, I have HIV AIDS and I've slept with man X. How would you feel? I'm sure you'll start feeling some form of violence against her. If you even get her, you might even cause harm to her. So I say it in that context that sometimes a lady does this because she has been wronged by somebody and will not tell that person when they're having sex, they will not tell that person that I have HIV. The intentions are bad. And then on the Vmmc, yes, when I said that we have made an effort to circumcise, to encourage our men to come out, to get circumcision, that is just one way of preventing. You must also apply the others. You cannot get circumcised, then you go around having unprotected sex. You will get HIV. I mean, so it's a combination of many factors. So we must combine all these things. Not one will help you. Several will help you. On NSP and OST, yes, I agree with your comments. My experience in Kenya, what happens in Kenya is most of those who inject drugs into their bodies they use one needle, several people. And most of these things are done behind the curtains in some background, somewhere where police cannot get you. Most of the drugs they inject themselves are illegal drugs which are banned in Kenya. So, my question that I will ask is, maybe there are those who inject themselves with legal drugs or drugs which are legal. But then how do we identify between the two? And do we just give the needles to those who are injecting themselves with legal drugs, or do we also give to those who are doing it at the back? Well, the experts can help us on that one. My final comment about the presentation or the situation is the government of Kenya feels that it's on the path to achieving health for everyone, to eliminating discrimination and stigma, and HIV and AIDS in Kenya by 2030, but this will not happen alone. We need partners, and we have worked with partners, but we need more partners within the country. We need a people-centered policy, which is already in place. We are looking at some of the legal barriers to see, to ensure that we undertake serious reforms so that we are all approaching 2030 with no one left behind. So my message is, no one is safe of HIV until everyone is safe, including the targeted populations, including those who are being discriminated, the specific classes that I mentioned. We can only say that we will all be safe when everyone is safe, just like COVID-19. Lastly, COVID-19, of course, has affected our efforts to deal with the HIV issues. My comment, or rather my recommendation to all of us, is to build a resilient health system, regardless of which pandemic or which disease is around, so that when we're hit by the next pandemic, we have a resilient health system that will deal with all manner of diseases. At the moment, most resources have been diverted to deal with the COVID-19 pandemic, meaning that we have left behind, or we are short of resources to deal with HIV and other diseases like malaria, which continues to kill so many children in Kenya and in Africa. So, and all society, all government, all society approach is the best policy to end AIDS by 2030. Thank you.
Thank you very much, Your Excellency. So last but not least, Mr. Taufik, please. We have a lot of to-do lists now.
Yes, thank you so much. And it was a very rich discussion. I'm so pleased with what was discussed and all the different complexities around the issue of stigma and discrimination. And I agree with Mukta. We simplify by joining them, because stigma and discrimination is easy, but we discussed that it is so complex. And many aspects come into addressing it. Stigma and discrimination work is not only a topic for advocacy and activism. We realize that we need to work more on bringing the science of the response to the issues of stigma and of discrimination separately or together, because they are strongly interlinked. And that requires empowering communities, empowering people, and also having the right legal framework that facilitates that empowering. We do not need policies that are reactive with punishments. We need policies that provide assurance that people will not face inequalities due to HIV status. That would help us avoid the situation that you mentioned. Whoever, whether it's a man or a woman, we will not face that situation if people understand that having HIV or not does not lead to, it's not a sentence to death. We know you equals you. And it's not a sentence to facing exclusion and inequalities. As long as we did not find practical solutions supported by the policies and legal framework to these issues, we still have a long way to do. And this cannot be done only within health sector or health system. We need to consider the whole comprehensive systems for health. Only if we consider, the issue around health service delivery setting, and we realize that in the global partnership, we talk about all the 6 settings. So the focus on addressing stigma and discrimination is not only about individuals. It tackles forms of stigma and discrimination in the different settings, and also their impact, so that we attenuate the impact of stigma and discrimination and ensure that everybody, no one is left behind, and we can then ensure we achieve the global AIDS targets, global strategy targets. Thank you.
Thank you. So that is conclude our the panel discussion. Tim, to say something. Tim, please. Okay. We have a lot of work to do. From now on, it's just the beginning of this marathon to promote this empowering and inclusive society, as well as the resilience and comprehensive system to work together to address this issue together. Thank you very much, all the panelists, including Harry from the online side. Can we give a big hand for all the panelists here? Mr. Taufik, Secretary Cabinet, Joel, Harry, and Ika, and all comment from the floor. Midnight and Dr. Mukhtar. So, thank you very much. I return the floor.
Thank you, the distinguished panelists and the audience for your reflections and participation. We have now come to an end of the panel discussion and Q&A session. So next, may I now invite Dr. Prisha Prempi, Deputy Director General of Department of Disease Control, to give a summary of today's discussion, which will be significant inputs for us to advance action to eliminate stigma and discrimination. Dr. Prisha, the floor is yours.
So, good afternoon, Kun Ek Siri Inta Ruchi, Director General Department of International Organization, Mr. Taufik Bakari, UNAIDS Regional Director for Asia and Pacific, Excellency, distinguished panelists, ladies and gentlemen. I am grateful to have the opportunity to be the lead rapporteur for this high-level seminar on ending AIDS, Zero Discrimination, One World. The seminar aims to raise global awareness and promote whole society and whole of government commitments in addressing stigma and discrimination, and to share information, knowledge, and experience in tackling stigma and discrimination and inequalities. Here in the short period, I would like to present the main point that have emerged from the panel discussion today. There are three key issues that have been addressed, which includes problem and significance of stigma and discrimination, its challenges and solution to reduce stigma and discrimination. The first seminar addressed the HIV-related stigma and discrimination continue to spread throughout the world and in all sectors of society. Stigma index, evidence gathering by community networks and civil society organizations, reviews significant level of stigma and discrimination and other human rights violations that impact people live with HIV and all vulnerable population. Certainly, stigma and discrimination are delaying the process towards to the global goal of ending AIDS by 2030. Secondly, despite the advance in prevention and treatment, stigma and discrimination remain to be the key barrier which need to be overcome in order to end AIDS by 2030. These challenges are the main cause of suffering and the abuse of human rights, particularly of those living with HIV around the world. They hinder necessary transformative change to reduce new HIV infection and HIV-related death. Third, the seminar has presented tools and programs that have proved to be effective in reducing HIV-related stigma and discrimination in different settings, particularly in healthcare setting, school-based, and workplace. Besides, country must enact and implement law and policy that protect against HIV-related discrimination, as well as comprehensive sex education for young people. This seminar also highlights the need for global and concerted effort of HIV-related stigma, discrimination, inequality, and AIDS by 2030. Finally, I would like to conclude by saying that eliminating stigma and discrimination require transformative change, strong commitment, and cross-sectoral coordination, and most important is global solidarity. Thank you very much.
Thank you very much, Deputy Director General Dr. Prisha. May I now invite Mrs. Exili Pintaruchi, Director General of the Department of International Organizations, to deliver a closing remarks.
Excellencies, distinguished panelists, ladies and gentlemen, I would like to express my sincere appreciation to our distinguished panelists for their valuable contribution to the seminar today. And I would like to thank you all the participants who have joined us this room and online for their engagement, which have had contribution to the rich discussion this afternoon. As summarized by Dr. Prisha, the lead rapporteur, there is an urgent need to address inequalities, stigma, and discrimination, which continue to be major barriers to access to HIV health services around the world. Stigma and discriminations also significantly undermine effectiveness of COVID-19 response today. I heard many speakers underline people-centered approach and the vital role played by the communities in raising awareness, promoting understanding, and delivering health support and services. A predominant message that has been raised throughout the discussion is importance of universal access to essential HIV/AIDS services. To achieve that, we need, first, a strong political commitment and a long-term investment to promote the right to health, including promoting such similar platform for continued sharing of experience and best practices to promote understanding and empowerment of peoples across sectors on issues related to the context of social, legal, and humanitarian settings, as mentioned earlier by the panelists. Second, sustained and uninterrupted supply of medical products and services in response to HIVs and other diseases. And third, enhanced technological cooperation and capacity building to ensure that medicines and treatment are accessible and available to all. Looking ahead, to translate these commitments under the goals, the Global AIDS Strategies 2021 to 2026 and the 2021 Political Declarations on HIV/AIDS into action, we need cooperation, inclusion, and participation from all countries, from all partners, and from all stakeholders, like what we did today. I would end here by extending my deepest appreciation to all of you once again, and to the co-hosts, the Ministries of Public Health and the UNAIDS. Together, we remain committed to making tangible progress towards the achievement of the SDG target by ending AIDS as a public health threat by 2030, as well as a world free of stigma and discrimination. Thank you.
Thank you very much, Director General. With the closing remarks, on behalf of the co-host, I would like to express appreciation to everyone for joining us today. And Finally, please don't forget to visit the exhibition on zero discrimination and the AIDS response organized by the Ministry of Public Health and the UNAIDS outside this room, and grab some snack boxes and beverages before you leave. I wish you a very good day and สวัสดีครับ